And we're recording.
Hi, Richard.
Yes.
Hi, I'm Annie. I'm a level 1 student nurse. I'm supposed to follow you today to shadow you.
Oh, hi Annie, how are you?
I'm doing well. How are you?
Oh, very well.
I understand you're going to see a patient right now. Can I get an SBAR report on that patient?
Oh, you sure may. Going in to see Miss Shanana O'Connor. She's a 34-year-old female. She was admitted to the ER at 5:30 this morning. Her pain level was a 4 out of 10, so we're going to check and see what her pain level is now when we go in there. She's A&O times 4. She's a full code. She came in from the ER on a wheelchair. She's stable. She has an elevated temperature, so she was complaining of fever, chills, general ache and malaise. She does have an allergy to trimethoprim sulfamethoxazole. Easy one to say. But we're going to double check when we go in to see her too, make sure she doesn't have any allergies to anything else. She's 177 pounds, 5'9" tall. She had an X-ray this morning, and blood culture is pending, and also waiting a urine clean catch. So we're gonna see if we can get that from her today as well. She is on dialysis. She's had end-stage renal disease for about a year, so she does get dialysis. She does also have diabetes mellitus since she was 8 years old, stage 1. She also does have some retinopathy and some neuropathy from the diabetes.
Okay.
She has a history of UTIs, and she also had a graft infection from an AV graft that she has on her left arm 3 months ago. So we're going to assess that as well. She has some numbness in her lower extremities and some mild sweating. She also has a productive cough, but she denies shortness of breath. She did smoke, but she quit 2 years ago. Her lung sounds are clear. She denies chest pain or palpitations. She is tachycardic with no murmurs, and she has 1+ non-pitting edema in her lower extremities. She has 1+ pedal pulses bilaterally. Her abdomen soft and non-tender, and her last bowel movement was Sunday, yesterday. She is also on I&O. She's having difficulty voiding, and she's also on fluid restriction. Her urine is cloudy, so we're going to assess that as well. So it's looking like there's signs of possibly a UTI infection that she has right now. So we're going to be giving her some antibiotics when we go in.
Okay.
Okay. Her urine white blood cells are high. She also has some high serum white blood cells, 12,400, so that's elevated above 11,000. So that's higher than what we want to see. She has a peripheral IV 18 gauge in her right median vein. And that's about it for her vitals are within normal range except her temperature. Her temperature is 101.1, heart rate's 95, O2 sat's 96, and her blood pressure is 138/78, so that's a little elevated as well.
Okay. Now, why specifically is this client receiving the medication that you'll be giving?
Well, because she's having signs and symptoms of infection. Her white blood cell count is high. Also, she's tachycardic, and she also has a fever. So we're going to prophylactically treat that with antibiotics.
That makes sense. Mm-hmm. Now, what action does the medication have on the body?
Well, the doctor ordered for her imipenem, cilastatin. Imipenem is a broad range antibiotic, and cilastatin is in there as well. It prevents renal inactivation of the antibiotic.
Okay. Now, when would you question administering this medication?
Well, we're going to be very careful with her because she does have the end-stage renal disease. So we're going to monitor her when we give the medication because we do want to be careful with that. And might want to watch her creatinine levels and her BUN levels.
All right.
After we administer it. So.
Does the medication have a therapeutic serum level?
Well, because she is an unstable patient with her renal disease and diabetes, and also because of her infection, the therapeutic serum levels for imipenem are not predictable. But it ranges peak levels between 1.56 micrograms to up to 58.8 micrograms.
Oh, okay.
So it's a big range for that.
Okay. What vital signs would you monitor with this patient?
Like before I said, the temperature, because she has an elevated temperature, we're going to watch that. Also going to watch her heart rate, because that's elevated also. So those are some signs of the infection.
And you sort of already answered this question, but which physiological parameters would you monitor when this medication is being administered?
We're going to watch, see if she has any additional diaphoresis, any additional sweating. Again, watch her heart rate and vital signs. Also, we're going to watch, make sure there's no allergic reactions to it. The most severe being anaphylaxis, which is systemic, and that can be life-threatening. So we're going to watch and make sure her respirations are good. She's having no problems breathing, no itching, pruritus, urticaria, signs like that. So we would definitely stop the infusion if we saw any signs of adverse reactions.
Now, what interventions should be taught to the client to ensure that the medication is being administered safely in a hospital setting?
In the hospital setting, we're going to make sure that the client understands what they're getting. I have some information here to give to the client regarding this specific antibiotic, so they can be aware of what they're getting also. Also, for them to be aware of the other medications she's getting. She's getting clonidine, Tylenol. We're going to just make sure that she understands what kind of insulin she gets. She gets two kinds, rapid-acting and long-acting. Also, with dialysis, she gets erythropoietin, and she is on atorvastatin as well. So making sure that she understands all the medication she's on. If someone were to come in and give her something that she's not aware of, she can question it, and that could be another check, along with the rights that we have, right medication, right time, right route, right dose, and also she has the right to refuse. So make sure she's aware of that too.
Okay, we just learned about that in school.
Oh, good, good.
Now, what interventions would you teach to make sure that the medication's being safely taken at home?
In the home setting, unless she has home health care, she's probably not going to be getting IV infusions at home. But that would be more with her other medications, making sure she knows how to inject her insulin, that she's aware of what the other medications do that she's taking.
Okay. And you've touched on this already, but the side effects and potential adverse reactions, are there any others aside from the anaphylaxis?
There are a couple. We want to very much be aware that this can potentially cause seizures. Also hypotension, so we're going to monitor, again, all her vital signs. And I said before also that we want to make sure we use it cautiously in renal impairment. So we're going to be taking labs, getting lab work done regularly for her. Also, there's a potential for superinfection, such as C. diff, that she could possibly get. So if she has any complaints of diarrhea, we're going to monitor that as well.
Okay. And my last question for now is, how will you know that the medication's effective?
Well, we're going to, again, monitor her for her temperature, her heart rate. Again, we're going to also have her labs done as well and see if her white blood cell count is trending back down to a safe level.
All right. Well, thank you so much for answering those questions. I know that you need to get in to see your patient.
Yes, yes. Well, let's go in and see Ms. O'Connor.
All right.
Hello?
Hi, Ms. O'Connor.
Oh, hey. How's it going?
Good. How are you today?
I'm feeling all right.
I'm Rich. I'll be your nurse today. And this is Annie. She's a level 1 student. She's going to come in and watch, if that's okay with you.
Yeah, of course.
Okay, great, great. Now, how are you feeling today?
I'm doing all right.
You are?
Yeah.
On a scale of 0 to 10, what would you say your pain level is?
My pain level's like a 1 right now.
Okay, so that medication I
Yeah,
gave
it's
you earlier.
kicking in,
It's
so
kicking in?
it's good.
Okay, great, great. Now let me just check your bands. Can you give me your name and your age?
My name's Shanae O'Connor, and I'm 34 years old.
Okay, great. And you have an allergy band.
I do. Yeah, that's for the sulfa drug that I'm allergic to. It's one of the really long ones. I can't say-
Trimethoprim?
Yes, that's what
Okay,
they call it.
okay, great. Any other allergies?
No.
None that you're aware of? Okay,
Nope.
great, great. So we're going to be giving you some IV antibiotics
Okay.
today, okay? So this one is called imipenem cilistatin, and it's a broad-range antibiotic, okay, to try and help that infection that it seems you might have. Okay, so that should help you feel better. You have any questions for me?
No.
No? Okay, let's go ahead and get you scanned. Okay, give me your name and age again.
It's Shanae O'Connor. I'm 34 years old.
Okay, great. Now we'll go ahead and take out her medications. Hey, Annie, one of the first things I do is I go ahead and, after I take it out of the package, I label the tubing.
Okay.
And we do it here for 72 hours, so it's good for that. So then the next person that comes on shift will know how long it's been up there for.
Oh, okay.
So we put our name and also the time. So this I'm pulling out first is just normal saline. Okay. So we want to check it and make sure the bag has no leaks in it, that the color looks good. Check the expiration date, make sure it hasn't been expired. Scan it. When we hang IV medications, we always want to make sure that we keep this part and this part sterile. Okay? Because this is medication that's going to go into the patient, so we don't want to introduce any additional germs. So make sure it's clamped off. And we fill the drip chamber about halfway.
Oh, okay.
I'm going to go ahead and prime the tubing.
And that's just to make sure that there are no air bubbles in the line? Is
That's
that
correct, yeah. We don't want to have any air bubbles introduced into the patient's veins. Okay. So the next thing I'm going to do is I'm going to go ahead and check your site, okay? You have any pain, any redness, swelling out
Nope.
down there? Okay. And we always clean it like you mean it. I'm
I've
sure
heard
you've
that
heard
before.
Okay, make sure this is unclamped. And this is just normal saline, so we check that as well.
Okay.
And I'm going to infuse this slowly. You tell me if there's any pain, okay?
Nope, no
Doing
pain.
Okay. Looks like this one's not to work. Let's try it again. There it goes.
Yep, everything feels like it's going in just fine.
It's going in just fine?
Mm-hmm.
Okay, great.
Should I let you know if I start feeling any pain or anything?
Yes, definitely let me know so we can stop the infusion, because that means that it's not going in correctly, okay?
Oh, okay.
Okay. Next, I'm going to take this,
Mm-hmm.
clean it like you mean it again. Okay. Start our pump.
Hi, Althea. I'm Kristen. I'm a level 1 nursing student. I'm going to be coming with you today to see your patient. Hi, Kristen. Can you give me the SR report?
Yes, our patient is in room 529. Her name is Martha Yarn, and she's 80 years old. She's full coat. She's got no known allergies. Her BMI is 29.1. She's on a regular diet, but she's going to be NCO after midnight. Her primary is Dr. Joey. And she's here for non-hearing.
Okay. Now I do a double check and make sure that I have the correct rate, which the order says 30 mils per hour.
Okay.
But they have no success with that, so that's why she was admitted.
And because it's a 1,000 milliliter bag, I usually set it for about 950, so it can alert us before it completely finishes.
Her
Okay.
last admission to the hospital was 6 months ago, and that's when she started developing this ulcer. She has no history of heart disease or other chronic illnesses, and
If you can see it over there.
her plan for tomorrow is
We watch and check.
surgery. They're going to do debridement.
Make sure we get some drops.
I'm going to do a quick
Turn occlusion because I forgot to open the clamp.
Neurologically, she is alert and oriented.
Let's try that again.
3, she's cooperative. She's slightly hard of hearing, and she has limited visual acuity. She has occasional watery eyes. She doesn't have any headache or any change in vision, any nasal problems or sore throat. She also complained of general weakness and fatigue. But on the assessment of her sacrum area, she reports no numbness beyond that.
Now we're looking for 5 drops to confirm that it's infusing.
Her lungs are clear on auscultation, and she was last admitted for community-acquired pneumonia, but she hasn't used any long-term oxygen therapy. She still has pending chest.
Okay, that's 5 drops.
Sounds to me.
So how's that feeling?
It's good.
Okay, great.
Cardiovascular system. She's got sinus.
So we always chart right after we
chest pain, any
start a medication.
Or shortness of breath. No syncope or pre-syncope episodes. Gastrointestinal. She's on a regular diet. She reported to have decreased appetite. She has no change in bowel movement patterns, consistency or color. No complaints of nausea or vomiting so far. She has positive bowel sounds in all 4 quadrants. Her abdomen is soft, non-tender, and non-distended. As far as her genitourinary system, she denies any lumps, bumps, or soreness in her breast. She says that occasionally she has stress incontinence, so we're going to do some bladder cleaning with her. She has pyuria, hematuria, or vaginal bleeding. And I already mentioned that she has stage 3 non-healing ulcer. It's 4 by 4 by 1 centimeters, and it's a full thickness. Sometimes she
Now that we've done that, we'll go ahead and start your antibiotics now, okay?
Okay.
Daily and drying, she uses some lotion for that.
Can you give me your name and your age again?
Yeah, it's Janina O'Connor, and I'm 34.
And it's an achy quality, and this has happened in the last 3 months. Usually it's relieved by acetaminophen, and she has a coordinated but slow gait. She uses a walker and to get around outside and in her house. She's a widow and she lives alone in a senior housing apartment. She has 2
And we also labeled this
children,
tubing as well,
and
okay?
they both live
Okay.
out of state.
And this came from the pharmacy, and we just want to look at it and make sure that it's the right color
She
and
has no history of
consistency.
surgery,
It usually
strong
comes white, maybe a little yellowish, but
Okay.
that's normal.
and her
They
last
inject it in the
menstrual
port
period
here.
was
So
30
we look
years
and make
ago,
sure we have the right
and she's
amount.
been menopausal for 24
It's the correct
years.
medication, expiration date.
And I'm going to go ahead and review vital signs. Her last vital signs were taken at 14:15, about 45 minutes ago. Her heart rate is 88. Her O2 is 92. Blood pressure is 144/90. And respiratory rate is 24. Her pain level was 6, and she got some drug for that, so we're going to ask if it went down at all. Her input was 850. And output is
Again, we want to make sure that the sterile parts remain sterile.
Okay.
Review her current medication. She does have Sensize prescribed for constipation. She has a PRN Percocet for pain. She also has IV
This
morphine
closed.
for pain, as indicated. And Ambien.
And you said you filled that about halfway?
About halfway, yes.
Yeah.
Okay.
And
Because this is the piggyback, it always goes higher.
And sodium chloride with potassium chloride.
Than the primary, and that just helps the gravity infuse that before the primary bag does. Okay?
For IV side is Novidoso metatarsal base. And Arsolab Pro, UA shows mild proteinuria, and that's probably due to the infection that she had. And her infection is in her bloodstream and is positive for E. coli. And her CBCs, the only thing that's elevated, that's abnormal is her white blood cells is 12,500.
Go ahead and clean this top port here.
As far as her CMP goes, her albumin is a little bit low, 3.2. It's supposed to be 3.5 to 5, and that's probably due to her having decreased appetite, so we're going to have to educate her on that. And her fasting blood sugar is 101, so that's normal.
Open the port.
Her potassium is normal, 3.6.
Okay, now we're going to set this for secondary.
Given her potassium, her sodium is also normal, 145. Her BUN is just a little bit elevated, 22, and creatinine is 1.5 normal. And the last thing I wanted to review
And you just want to
is
confirm.
her plan
500 milligrams, 100 milliliters over 1 hour.
Okay.
She's going to be NPU after midnight because of the surgery in the morning. Vital signs are every 4 hours.
As you can see, it shows right over here.
With the standby assistant.
And we just want to check the drops up here. Looks like we're getting some good drops. You doing okay there, Ms. O'Connor?
Yep, feels
Okay.
kind of cool when it goes into my arm.
Okay, that's normal, as long as there's no pain or redness or swelling, okay?
Nope, none of that.
Great.
For post-op care, and there's also dietary consult for her increased appetite. We're going to evaluate her pain level, and we're going to clean her wound with saline and cover it with hydrocolloid dressing. Do you have any questions? I think I pretty much covered everything.
I think you covered everything on SBAR. I do have a couple questions for you. You mentioned that patient's going to be getting gentamicin. So why?
And right now you're just charting what you gave?
Yes, we always chart immediately
She's
after we give the
getting a
medication.
gentamicin because she has an E. coli infection in her bloodstream, and gentamicin E. coli is sensitive to gentamicin. That's why we're choosing a specific antibiotic. And then as far as the potassium chloride, we got to make sure that she stays hydrated because it's important with the antibiotics. And also since she has a history of dehydration, and her potassium right now is 3.6, so it's safe to give.
Okay, and does it have a specific action on the body?
As far as the action in the body, potassium chloride will help prevent the depletion of potassium in the blood, and the gentamicin acts by inhibiting protein synthesis in bacteria, and that's how it has that bactericidal effect.
Still doing okay over there?
Is there any time that you would question administering this medication?
Now I have some information for you just regarding the antibiotics that you're getting, okay? So if you want to read those over at your leisure.
Sure.
And then I will be in shortly. We'll do some more vital signs, and I'll check you again, make sure that's doing okay. And if you have any questions, you can let me know, okay?
All right, sounds good.
Okay, is there anything else I can get for you right now?
Nope, not right now. I'm set.
Okay, wonderful. Now here's your call light. So in case you need anything, you just push that, and I'll come in, see what's going on, okay?
Sounds good.
Okay, wonderful. Thank you, Ms. O'Connor.
All right, I'll see you in a bit.
Okay.
Chloride, potassium chloride, I would never give this medication.
Now, I thought of a few more questions while we were in there.
Oh, sure.
Were there any pertinent pieces of information that you reviewed before administering the medication to the client?
Yes, there were. Of course, we went ahead and flushed the line to make sure there was no infiltration in the line. If there had been, then we wouldn't have given the infusion. We would have checked that and probably discontinued that and started a new line. Also, we checked to see, make sure her mentation was okay. Her vital signs were within normal limits. If she hadn't had an elevated temperature, elevated blood cell count, white blood cell count, or tachycardia, we would have questioned why she would be receiving antibiotics.
Okay. Now, did this information affect your decision to administer the medication?
It did. Again, if she hadn't had those signs and symptoms, we would have questioned the order.
And did the information affect how you administered the medication at all?
Not really. The order was for IV medication. She already had an IV started, so that was the appropriate place to give this medication. So.
All right. That covers all my questions. I really appreciate you letting me follow you today.
Of course, no problem. Good luck in level 1.
Thank you very much.
Okay.